health, security and education workers who were not absorbed in the health system post the COVID-19 pandemic are taking to the streets today to demand answers from the Gauteng government. In 2022, an estimated 8,000 healthcare workers were hired, but as temporary staff. This was during the height of the COVID-19 pandemic, and they had to then be released. The disgruntled workers have gathered at Mary Fitzgerald Square, that's here in Johannesburg, to march to Premier Panyaza Lesufi's office. They say they want to know why they were not considered for the Nasi Ispani employment initiative. Newzroom Afrika's Nqobile Madlala is there for us, and she joins us now. Nqobile, good morning to you. How many workers are we talking about that have come out in numbers to march there behind you?
Well, Koli, I'm just going to step out of this shot so you can see some of those workers, but it's a huge number, and we know that more are yet to come, and we know that they are going to be, of course, marching to the Premier's office to sort of ask those questions around the Nasi Ispani. A lot of these are officials that were working. Some of them were even porters during that time of COVID, and some of them were not considered for Nasi Ispani. So I want to bring in now Operation Dula to speak to us, because these are some of the people that are going to be helping them march to the Premier's office. And perhaps I want to start with, how many people have you spoken to that want to question this Nasi Ispani, to say why were they not considered?
Look, last week we were approached by the leaders. We were here at the office of the Premier with about 400 or so. But the people that we spoke to, there's a leadership that represents about 8,000 people who were COVID workers. And today, the number has actually increased. We realize that it's not only 8,000. We have patrollers today and all other essential workers. Pathologists are here, and some of the people who worked during that time. So we're actually talking about 15 or so thousand people that are actually questioning this thing, to say that if you open these opportunities, why do you open them for political expediency? These are the people who are essential workers. Their services are still required today, but they're not taken in. And we don't understand. And the sad thing is that the Premier himself has created a legitimate expectation amongst these people. He told them to go and collect their letters. And when they get to all the facilities, none of them has received their letters. There's a very small number of people that are receiving these letters. But we don't understand the criteria. We don't understand what's the rationale behind it. But all opportunities that are created for these people, but they're still unemployed today.
And tell me, what kind of work were these people doing? Because, we know there's health part of this, but what work exactly were they doing?
Majority of them are nurses. These are professional nurses. These are registered nurses. These are people that all public health facilities still require them and need their services today. The queues are long, but the people are outside here. Money is been mobilized, but mobilized for political expedience, and this can't be right. It cannot be right.
And now, what's on the memorandum that you are delivering?
The first thing on the memorandum is that the people must receive their appointment letters. The second important thing is that you don't take these people, these are essential workers, don't take them for 12 months. Your next step should be to employ them permanently, because at least they were promised that. So they must be employed permanently, and because all public health facilities require their services. So these are the main things. But the immediate thing is that give them and absorb them in the 50,000 opportunities that you've created now, and give them their appointment letters. That's key for today.
Thank you very much for speaking to us. Now, I want to bring in one of those people that are currently affected. And Mama, you were saying that you were also a porter during COVID. And how does then it make you feel knowing that you have no job right now?
You're not in Mama, because COVID ka 2020 bari hira ne bari bitsa di frontliners bari bitsa di hero. So hona no bari ntsheditse ka ntle jwale ka matlakala. Ke bohloko ne robala mo 2 nights in a row o robala ka ntle mo people, and only to find that re ba tlonka only 511 ya batho the rest rena a rankiwa re kwaletse ka ntle ke bohloko hampe mama ke bohloko haholo. Some of us COVID ne ya re tshwara mama ka dula sepetlele ka ba oxygening no every time ha ke robala tshwantse ke robale ke nwa meriana every day chest ya ka ha sa le sharp so hona tse ke dutsa ke sebetse go nka ga tshaka re ka meriana eo mama ke bohloko government a rena wa re faila mama ene wa tsa ha ke nahana hore bankile only 511 ene hona dipetlele mena se hona le batho ba tlileng ntse re le kwa today ba kene ka hare ba sebetsa rona re dutse ka ntle re tswile ka ntle mama ke be ga utla botlhoko ha ne ba re fa di letter of termination le contract ya fela ka 31 tsa March ga utla botlhoko mama ke ne falla kona ne bile ke a ke tsebe ke botlhoko mama pela ka e botlhoko haholo mama e botlhoko so much.
And Mama, I want to bring you in as well. You also had the same experience. What do you want to say today to the Premier?
Premier la ekhona ngicela ukuthi azi nje ukuthi asikho happy neze angakhipha amaphosti kanjani sikhona sihleli government for 3 years what about abantwana bethu sizosebenza uhleli 3 years la ukhona akasikhiphela amaphosti sisebenze iyo nje into esifunayo ngoba kubonisile ukuthi imali ikhona akusukuthi ayikho imali kunini silala lana nala sihlala khona sisemqashweni siphelelwe na izindawo asana ndawo zokuhlala asinamsebenzi silambile nje kahle kahle kudala silala la kwa Premier office mara kunamnyakazo siloku sithembisiwe into engekho kunini sithembisiwe guys sikhathele kakhulu.
Siyabonga kakhulu mama. I want to show you again, Xoli, whilst those ladies show you, these are some of the workers, some of them speaking to us and saying that they were promised their jobs. They have come here back and forth asking to be absorbed. They have not been absorbed. The lady is explaining to us that even her chest is still a struggle till this day. She was one of the porters that were working in hospital during COVID, and she says that ever since she struggled after getting COVID because she was a frontline worker and an essential worker, and as a result she now struggles and has health problems because of that. So some of these workers gathering today at Mary Fitzgerald was just asking one thing: if there is money, why are they not absorbed? Because they were also working. They were told that they were heroes, and today they do not have jobs as what they had been promised back then. So most of them saying that they are going to be delivering the memorandum, but the ask is very simple. They want the jobs, they want to work, they worked during COVID, and they have really a right to then get a job now, and that's what they're asking.
Nqobile Madlala, thank you very much. Live for us at the Mary Fitzgerald Square. That's here in Johannesburg.